Welcome to the Department of Radiation Oncology Post-Grad Graduation Ceremony 2021. My name is Megan Ward. I'm the business manager of UTDRO. I'm covering for Evan Donahue, as I'm sure most of you know. You probably haven't met me yet, though. So welcome. We're so glad to have you here today. I just have a few housekeeping items to start, and then we will get started with the formal event. So as you may have noticed when you joined the Zoom meeting today, you were automatically put on mute. So for the duration of the formal ceremony, if you're scheduled to speak or you are a graduate accepting your certificate, please remember to unmute, turn your camera on to do so. Once you're done speaking, please mute your microphone so that we can make sure the focus is always on the speaker at the time. As we are gathering virtually tonight, and we usually would be in the Heart House where we can all see each other, if you feel comfortable and have the capability, we do encourage you to turn your cameras on so we can create collegiality during tonight's program. At the bottom of your screen, you also have the option to share some reactions, as well as you can type into the chat. So please use those to cheer the graduates on and show congratulations throughout the event. You can use a thumbs up or the clap icon. If you are disconnected at any time, please rejoin the link that you received in the emails. If you or anyone that you know is experiencing any technical difficulties, please send us a private chat, or you can email the Radiation Oncology email, and that's where we will be watching and can assist you there. As we are gathered in a virtual space today, the graduates will not be getting their physical certificates and awards at this time. These will be mailed as soon as the staff are back on campus, allowed to be back on campus. We hope to be hearing from our graduates today during today's ceremony. And when you're replying to accept your certificates, we'd love to learn about your time at UTDRO and your plans for the future. So I am pleased to now hand it over to Professor and Chair of UTDRO, Dr. Fifi Liu.
Thank you so much, Megan. And I want to welcome everyone, our graduates, your graduates' family members and fellow UTDRO, and thank everyone for attending this very special occasion as we're celebrating the graduating classes of 2021. I would like to first begin by acknowledging this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home of many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. This evening, we're celebrating the hard work, dedication, resilience, and long days and nights of 14 radiation oncology fellows, 4 radiation oncology residents, and 5 medical physics residents. Your ability to persevere while navigating the significant challenges, the trials and tribulations caused by this pandemic must be absolutely commended. We're all deeply grateful for all the clinical care that you have collectively helped us deliver during the past 1.5 years of COVID, experiencing all the uncertainties, abiding by the PPE guidelines along with the rest of us, and at the same time, feeling the isolation and the loneliness, particularly for our trainees whose families are in distant locations. We know that this has been tremendously stressful for you and everyone, and we're so grateful for all that there's finally light at the end of this dark tunnel. Despite lifting the restrictions, as you have heard, we're still holding this event virtually this evening, but I can't tell you how excited I was when I was able to finally book a restaurant reservation for the coming week for my husband and I as we're celebrating our wedding anniversary. So next year, this event will be at least in part in person. But I do want to state that our Department of Radiation Oncology at the University of Toronto is recognized nationally and internationally as one of the largest training programs, as well as being amongst the top 3 most successful programs in the world. It is competitive to get inside our doors, but once you're in, we unconditionally support your learning, your research, and your training experience, and you should be proud to carry this banner of achievement with you for the rest of your career. In addition to your own efforts, of course, we must acknowledge and thank our talented faculty who serve as your educators, your mentors, and your research supervisors, who all help to diligently guide you throughout your training. And as I have mentioned to many of you on our one-to-one meetings, graduating from UTDRO opens doors for you. Chairs of Canadian and American departments email me on a regular basis asking whether there are more of our graduates that they can recruit to their own centers. And senior residents who are seeking fellowship opportunities are met with a similar level of enthusiasm. So you should all be very proud graduates of UTDRO and know that opportunities await you as a result of all your accomplishments here. And as new graduates, you will also be joining the ranks of our esteemed alumni, many of whom have gone on to make tremendous contributions in our field of radiation medicine. Our graduates have gone on to distinguished careers, creating change, innovating, and impacting our field as well as society at large, locally, nationally, and internationally. And alumni engagement, of course, is a critical part of us achieving our vision of being the global leaders in radiation oncology research, education, and clinical practice. And as such, every year, UTDRO hosts a reception at ASTRO. And this year, we're still all trying to figure it out. But nonetheless, we're obviously optimistic that life is going to be returning to some form of normalcy soon. And I hope to see many of you at our future ASTRO receptions in the years to come. And to highlight your career achievements and impact, we have launched the annual UTDRO Alumni Award. Our inaugural recipient in 2019 was Dr. Matthew Foote, who is now a highly successful practicing radiation oncologist in Brisbane, Australia. A 2020 recipient was not selected because of COVID, but we are very excited to be continuing this award for this year. So please visit the alumni section of our website for the criteria and to submit your nominations for the 2021 Alumni Award. And to finally underscore the leadership group that you are now joining, just here in Ontario, 8 out of the 14 heads of the Departments of Radiation Oncology across the province are all UTDRO alumni. So congratulations once again to each and every one of you on your exceptional achievements. We're truly excited to see how your careers are going to be unfolding in the years to come. So without further ado, I'm now going to be turning the virtual floor over to Dr. Glenn Bandera, Associate Dean, Postgraduate Medical Education, Kennedy Faculty of Medicine, to say a few words. Thank you. Glenn?
Thank you very much, Dr. Liu. It's my pleasure to attend remotely. I'm in rural Ontario enjoying a few days of a break, but I didn't want to miss the opportunity to dial in and be part of this celebration. We do this every year across a number of departments who want to recognize this important transition in medical education. And I really commend the DRO as well as the Temerity Faculty of Medicine Advancement Group for providing this opportunity. It really has been an interesting year, and certainly from a leadership perspective, I have really, really appreciated the tolerance and the patience that all of you have shown, residents, fellows, faculty, everybody, in helping us navigate this challenge. And I say with all elements of sincerity that it really has been a group effort. And I think we have co-created solutions and we've risen to challenges together as a community. And I think that really, really bodes well for the future, because we have these artificial divides amongst us. You know, residents are residents and staff are staff. But at the end of the day, we're all professionals trying to make medicine better for everybody, for our patients, for ourselves, and for the academic community. And I am certainly absolutely confident that you have acquired all of the skills to participate in that great endeavor that we all share going forward. One of the key messages that I think we've learned in the last year and a half is that nothing's forever, and things change all the time, not always to the magnitude that we've seen them in this last little while, but change is a constant. And if we've done anything well, I hope that we have equipped you to respond to change, to be receptive to change, and to be leading change within your profession, in your hospital, in your clinic, nationally, wherever you find yourself, wherever your interests take you. Hopefully, you'll feel confident and competent to participate in responding to whatever changes come our way in the next little while. On behalf of Dean Trevor Young and Vice Dean Patricia Houston, I want to congratulate all of you for all that you've accomplished during your time here at the University of Toronto, and wish you well wherever you're going, whether it's to fellowships, off into staff positions, into leadership positions. We all know that you'll be called upon at many points along the way to contribute some leadership skills. And again, I hope we've instilled those in you and provided you the confidence to say, yes, I'll take that on when the opportunity presents itself. It is a big community. University of Toronto is a big place, and our alumni community is every bit as large. And I hope you feel that you're joining a very large and international alumni community. You can't go anywhere in the world without running into somebody that has a connection to the University of Toronto. And I think certainly my experience in leadership here has shown that anytime an event happens somewhere in the world, it will affect people here at the University of Toronto in very, very intimate and special ways. And we do our best to recognize that. It's an obligation we have as a large, diverse, and very popular Faculty of Medicine to embrace everybody and create an inclusive environment for everybody. And I really hope that you all, to a person, have felt that here at the University of Toronto, and will continue to feel that as part of our alumni community. So I'll finish by saying thank you, Dr. Liu, to Dr. Baziak, Dr. Croak, leaders of your educational experience. Thank you for all you've done this year. And to the graduates, thank you for all you've done. You've enriched our lives as faculty members. You have learned and taught along with us, and for that we are very grateful. So with that, I will finish it off and turn it over to Dr. Michael Milosevic, who is Vice Chair of Research, who I believe is next in line to present some research awards. Thanks for having me. Take care.
Thanks very much, Dr. Bandera. Thank you very much. Great words. So as Glenn said, I have the pleasure this evening of acknowledging the fabulous research contributions of our residents and fellows over the past year. This is an important aspect of our program at the University of Toronto. Research is a key pillar of everything we do within our program. And it's an important part of all of our training and educational activities. We want our fellows and residents to come out as excellent physicians, highly skilled and highly trained, but we also want them to have acquired research experience and the ability to be inquisitive and continue this inquiring thinking throughout their careers, and the research training that happens at every level of our program, we all hope inspires that for everyone as they move forward. It's been a difficult year, as both Dr. Liu and Dr. Bandera mentioned. It's been incredibly challenging. We all have been stressed with trying to maintain a balance between what happens at home and what happens here in our workplace. And that's particularly challenged because of the increased demands on clinical care that we've all had to cope with over the past year. And despite that, I've been so impressed with how successful our trainees have been, our residents and fellows, how all of you have been with research over the past year. And I think this was reflected in Research Day that we held a few weeks ago, not that long ago. And we actually didn't know what to expect this year because it's been so challenging. But I would say, and I think all of us would agree, that the quality of the research that we saw at Research Day from our residents and fellows was absolutely fabulous and really no different than what we've seen in previous years. And that speaks to the commitment and the dedication. So I'd like to thank all of you, all of our residents and fellows who have worked so hard in this regard over the past year. And also their supervisors, because it has been challenging for even that relationship to evolve between a supervisor and a resident or fellow because of the virtual space that we're all living in. So thank you to everyone for making this happen. There are 6 research awards that I have the pleasure of announcing. At Research Day, there were judges scattered throughout our virtual room. I'd like to thank them as well for going to the effort, the great job that they did to score all of the presentations, and to the research committee for helping sort through them all. So without further words, I'd like to begin by announcing the W.J. Simpson Award for Academic Excellence in Research by a Radiation Oncology Resident. And this year, that goes to Badr Id Syed. The second award is the R.S. Bush Award for Academic Excellence in Research by a Radiation Oncology Fellow. And the recipient this year is Hanbo Chan, who's a clinical fellow at the Odette Cancer Center. The third award, the J.R. Cunningham Award for Academic Excellence in Research by a Physics Resident, goes to Humza Nusrat. The Richard P. Hill Award for Academic Excellence in Research by a Graduate Student is awarded to Nader Alam, who is a PhD student in the Department of Medical Biophysics. The Best Poster Award for Academic Excellence in Research is to Jun Won Kim. And finally, the Chairs Award for Academic Excellence in Research. This is an award that Dr. Liu decides on, having looked at all of the presentations and integrated all of the information that she is able to take in, which I think was a challenge for her this year because of the virtual space and everything, but she managed to do it. And the recipient this year is Dana Kelty. So again, thank you to all of our residents and fellows for the efforts that they put in this year, for making this come to fruition, and for everything they actually did in this very difficult time with COVID. Thank you. I'll now pass on the virtual podium to our Chief Physics Resident, Hedy Mohseni.
Thank you. There are a total of 12 physics residents at 5 UTDRO affiliated cancer centers across the GTA. We rarely have the chance to get together or interact with physicists from other centers, especially during COVID, which makes electing a winner a bit challenging. If there is a silver lining to this pandemic, it is perhaps that it allowed us to get closer and interact more through online meetings, and gave us an opportunity to find a method of choosing the recipient for this award in a way that all centers are represented equally and fairly, regardless of their number of residents and for their votes. But this was certainly not an easy choice. Words like thoughtful, encouraging, approachable, unprecedented role model, effective teacher, as well as warm and fuzzy are only a few words used by the residents when describing their center's nominee. We are truly grateful to all the site coordinators and physicists involved in training, supervision, mentoring physics residents, and acknowledge their contributions. But unfortunately, there's only one award to be given. So on behalf of all current UTDRO residents, it is my honor to announce this year's winner of Excellence in Physics Teaching Award, Dr. Beibei Zhang from South Lake Regional Cancer Center. Dr. Zhang is a staff physicist at both South Lake and Princess Margaret Cancer Centers, and also the deputy head of physics at South Lake. She is very much involved in training physics residents, in addition to her many clinical and research roles. She has supervised and mentored physics residents throughout her career and leads multiple clinical rotations and evaluations. I speak from experience, having her as my clinical project supervisor, when I say Beibei is very generous with sharing her wealth of knowledge, expertise, and time. Her approach to teaching, is one of grace, kindness, and patience. She's incredibly approachable and goes above and beyond to help, be it in the clinic, career advice, or day-to-day matters. So Bebe, congratulations and thank you for being a great physicist, teacher, mentor, and most importantly, a truly great person. I am sure everyone who knows you and has worked with you share this sentiment. Lastly, I would like to take this opportunity to express our sincere gratitude to Dr. Andrea McNevin for her incredible leadership, care, and expert and valuable advice as the director of the physics residency program. And thank you all for your attention. I will now pass the virtual floor to Dr. Andrea McNevin, the director of the UTDRO physics residency program.
Thank you, Hetty, for the kind introduction, and congratulations to Bebe. Lucky to keep you in the UTDRO family as you move to Sunnybrook in the coming months. First off, it's a pleasure to have all of our physics graduates in one place and able to join us tonight. We unfortunately could not properly celebrate all together their residency success when all 5 of them completed their programs at the end of last August. You know, throughout their 2 years, they have a lot to balance in terms of research projects, clinical rotations, and clinical commitments. And to be able to balance that as well within the last 6 months of their residency, to also have to balance you know, the COVID pandemic and the impact both on the end of their residency and on job search, it was quite hard for them to do. So nice to have them all with us today and not only celebrate their successful residency, but also their successful certification, as all of them were successful in their certification exams a couple months ago or a month ago, as they all move forward in their careers. So that is excellent. And on behalf of myself and all of the program faculty, congratulations. And we look forward to working with you in the future as colleagues and to be able to observe your success and hopefully work with you in many different professional capacities. I think you're all going to do excellent as you move forward. So to congratulate our first resident in alphabetical order, joining us from, I believe, Sunnybrook, where he's currently, where he's working, is Victor Yakovenko. Congratulations, Victor.
Thank you very much, Andrea. Yes, Sunnybrook, that's correct. And hello, everyone. So we were asked a question to identify things that were most valuable in UTDRO. And so there was a lot of things, of course, that were valuable, but I can sort of crunch down to like 2 most appreciated things. So first, the desire and commitment of UTDRO to deliver the best training with a big picture flavor. In our multidisciplinary field, it's very important. So the quality of your work is as important as the integration within the multidisciplinary team. And then the second is the active UTDRO support of trainees to succeed. So to me, this was especially important because I'm an immigrant to this country, which now I call home. And UTDRO had played a significant role in helping to rediscovering myself in Canada. So all this sort of helped me to crystallize some kind of guidelines to move forward. So work hard, advertise your work because others should know what you're doing, increase your network, and if you're lucky, rest in between. Thank you.
Congratulations, Victor. Our next candidate is Lee McDonald, joining us from his new position at Dalhousie at the Cancer Center in Halifax. So congratulations, Lee.
Thank you, Andrea. And it's absolutely great to see everybody. It's great that we can get together even virtually. And yeah, I'd just like to say thank you very much to everyone in the program. Something that I really valued was just the generosity of all of the experts and mentors that I had throughout the residency, and how generous they were with their time and willing to share that expertise. And that's something I truly valued, and I carry forward now, as I begin my career. And I really greatly appreciate it. So thank you very much, everybody, and it's great to see you.
Thanks. Congratulations, Lee. Our next resident alphabetically, congratulations to Victor Malkov, who's now a physicist at Princess Margaret Cancer Center, so joining us from Toronto. Congratulations, Victor.
Thanks very much, Andrea, and everyone. Thank you for being here. Yeah, so I'm around at Princess Margaret now, which is a great opportunity to continue to learn. And I think I'm going to echo Victor's and Lee's comments in terms of being very appreciative of everyone in the program, all of the experts that have helped us along, and in a very friendly manner, which really, really helped with all of our studying and education as we went through. And of course, their continued commitment to quality and making sure that we're delivering the best care. And that's something that we will all carry forward, I think. So thank you very much.
Congratulations, Victor. Our fourth physics resident is Kelly McPhee. Congratulations, Kelly. Kelly is joining us from Winnipeg, where she's a physicist at Cancer Care Manitoba. Congratulations, Kelly.
Thank you, Andrea, and thank you, everyone else. It's great to be able to join this virtually because I wouldn't be able to be there in person if it was in person this year. I am most grateful, really, for people that were participating in the program. I'm very grateful for everybody that provided mentorship and teaching throughout my program, whether it was official because they were officially my mentor or supervisor, and officially part of the program, as well as everybody else, all the physicists, all the ROs that I was able to interact with. There's a great deal of expertise and a commitment to learning and a commitment to pushing the field forward as part of the UTDRO program at Princess Margaret. And I'm just very grateful for that experience and all of the experience I was able to learn from. There's just so much expertise there to learn from. So thank you so very much.
Congratulations. And our fifth graduate from last year is Jason Vickers, who is now working as a physicist in London, Ontario at the Cancer Center there. So congratulations, Jason.
Thank you, Andrea, and thank you everyone for being here today. As Andrea says, I'm now lucky to have the opportunity of working in London, Ontario as a physicist, which is fantastic. And regarding the UTDRO, I'd have to say one of its greatest strengths was really, as many people have said, the breadth of experience and expertise that's available at the UTDRO from many different hospitals in the GTA. That really gives you an understanding of not only how your center does different things and excels at treatment and patient care, but how other centers can do it as well, and how different ideas overlap and different people overlap. And how really the idea that even me being in one of the smaller centers compared to say PMH or Sunnybrook, I really found that no matter one of the physicists or oncologists that I would reach out to, they'd be very open in helping me and helping to pursue my goal in medical physics. So really I found that was great in giving me that introduction to the greater sphere of radiation oncology. So thanks everyone for being here. Thanks.
Congratulations, Jason, and congrats to all of you. Look forward to seeing you in person, hopefully at meetings in the future. And I will now turn it over to the Chief Radiation Oncology Resident, Dr. Michael Chong.
Hi everyone, thank you, Dr. McNiven. Hi, my name is Michael Chong. I'm the current Chief Resident, and I'm very happy to be here with you all on such a special day, celebrating the achievement of our residents and fellows, and on behalf of our resident group and for everyone graduating today, I would like to congratulate all of you for your amazing achievement throughout your time here in UTDRO. And for the ones moving on to a new place for their next phase of their career, we will miss you all. And for the graduating PGY5s, Aisha, Gordon, Liang, and Yoni, congratulations on being fully certified radiation oncologists. It has been such a wonderful journey and working and learning with you all. And thank you so much for being such amazing colleagues, role model, and friends. And we will always appreciate your willingness to show us how to contour the nodal stations, how to change the pinnacle resolutions on like our PCs, and how to connect our computers to the right printers. And we wish you all the best in your career and life. And we are proud of you, and please stay in touch. And also, I am honored to announce this year's Residence Award for Excellence in Clinical Teaching for fellows and staffs to acknowledge the fantastic resident educators that we have in UTDRO. And these awards were voted directly by the residents, therefore a super big deal with p-value definitely less than 0.05. And this year's award for staff goes to Dr. Yelena Lukovic. Please applause for her. And this year's Residence Award for Excellence in Clinical Teaching by Fellow today goes to Dr. Hendrik Tan. He was a fellow from Sunnybrook. I think he is also in the call. Please applause for him too. And yeah, congratulations for the very deserved awards. And our residents are very thankful for your passion and dedication in resident learning. And that's all from me today. And please welcome our program director, Dr. Baziak.
Thank you very much. It's such a pleasure to greet you all. And I'm actually very delighted that our incoming PGY1 residents have joined us, and perhaps even some incoming fellows as well. So before I turn to the graduating residents, I want to thank four people who were critically important to the success of our program. First of all, Catherine Wong. Catherine has worked so hard this year, every single year, but this year was exceptionally hard. We had accreditation, the whole university had accreditation, which was tremendous amount of work. We have two cohorts of residents, traditional and competency by design. And on top of that, this pandemic thing happened. And we had to quickly turn around to virtual exams, virtual OSCEs, virtual everything. And on top of that, Catherine has two school-age children at home. So on top of being a full-time, 3 people in one, she also had to look after her family. Thankfully, she's so ably supported by her colleagues at UTDRO, and that obviously helps a lot. Second person I'd like to thank is Hani Soliman. I don't know, I hope he's joining us today. He has been associate program director for the residency program for the last quite a few years, and he will be stepping down at the end of June and passing on the baton to Jay Detsky. And we are very grateful to Hani. He's done a tremendous amount of work, answers my email at any time, gives thoughtful advice, and has been doing a lot both in front of the scenes and behind the scenes to support our program. Third person I'd like to thank is Dr. Rebecca Wong. She has completed her VP Education term, and she has also been tremendously engaged, supportive, hands-on, wise in her guidance. Again, as a reaction to the pandemic, her first reaction was, how do we support our learners? How do we make sure we're doing what we have to do to support them? And I'm sure it will be equally ably guided by her successor, Dr. Mei Tsao, who has started in January. And finally, I don't know if you know, but I suspect that this is Glenn Bandiera's last official graduation of our residents in his role as Associate Program Director of PGME. He will have many other roles, including being family member to our department, but he and the PGME have been a tremendous support, particularly in the accreditation year, as Catherine and others well know, but also throughout. We are really very fortunate to have a very well-organized residency and postgraduate education program to support our efforts. So I hope I haven't, and of course to thank all of you and all of the faculty and all of everybody who supports our residents. And now I'd like to turn to our graduating 4 residents. I'll take you in alphabetical order. Aisha, ahlan wa sahlan. It's a delight to see you and your family members, because Aisha is at the moment in Kuwait. And I'll just say a few words and then turn the podium to her. So she completed her education in Kuwait. She was a recipient of gold medal for academic excellence in physics Olympiad in her education there. And from the beginning, when she joined us, us. She showed tremendous clinical dedication, hard work, and engagement, and self-confessed reputation for having the most complex on-call experiences, except I think some of the junior residents are starting to threaten your reputation. But of course, even then, you always stepped up to the plate and delivered well above the clinical expectations. Aisha was resident-elect, member of the Wellness Committee. She's done research with Dave Schultz on CNS re-irradiation. She was engaged in Global Health Certificate Program. She funded a NGO for refugee health. She had research presentation at UTDRO on refugee health. She has a great sense of humor, is very personable, is a very stylish dresser, and despite critical family situation that called for her to go to Kuwait on short notice, she was successful in passing her Royal College exam. We're so happy that she'll be staying in Toronto for a little bit longer, doing a GU brachytherapy fellowship at Odette. Aisha, you can have the microphone.
Okay. Hello, everyone from Kuwait, where there are big families, as you can see, and these are only small portion of my nieces and nephews, and where there's hot temperature. It's reached now 50 degrees Celsius, and it's already in early June. I'm so thankful to be part of University of Toronto residency program. I think not lots of people can go for an emergency, family emergency, and stop studying for 4 weeks prior Royal College exam, pass an exam, but it requires a really strong program to prepare you for that. And I'm so thankful to have an amazing support from lots of mentors and staff. And I've gained so many friends that I'll be forever thankful for, and I really hope to maintain the friendships for a long time afterwards. And I'm so happy to resume my fellowship in Toronto for the next year. I'll definitely stay in touch with everyone. Big thank you for my family, especially for my father, who was lost to the pandemic, but that's it. Thank you.
Thank you, Aisha. So lovely that you could join us, even though it's so late in Kuwait. And the little ones will have to go to bed soon, I think. The next in alphabetical order is Gordon Locke. Gordon came to us with a Bachelor in Science from Western and an MD from McMaster University. In addition to his clinical training with us, he has been pursuing a Master's of Science in Health Professions Education at Maastricht University in the Netherlands, which he will be completing soon. He has publications and presentations in prostate cancer and in hyperfractionated radiation, and he has had many administrative leadership roles, including assistant chief resident with us and quite a few leadership roles in PARO and the OMA. On a personal note, he managed a long distance relationship, and I think Melanie is probably with him or with us to congratulate him, and I hear that wedding bells are around the corner, and he will be going to Ottawa for a CNS GU fellowship. Congratulations, Gordon.
Thank you, Dr. Baziak, and thanks for everyone coming out and supporting all the graduates today. The last 5 years have flown by, and I've had the opportunity to meet so many incredible people, and they've really allowed me to grow and help shape me to become the best oncologist that I can be. When I look back at the last 5 years, I definitely value these connections the most. The mentors that have guided me along the way and the skills that they've taught me. And I am most excited to join my fiance in Ottawa, where she's taken on a staff role, and I'll be pursuing a fellowship in GU and CNS.
Thank you. Congratulations, Gordon. The third in alphabetical order is Yoni Weiss, who is joining us, I think, with family celebrating with him. Yoni completed his Bachelor of Health Sciences NMD at McMaster University. He has been assistant chief resident and then chief resident during the most challenging time of the pandemic, and really rose to the occasion. Leaders are really made in difficult difficult times, and this was completely something nobody could have prepared for. And his calm and collaborative and wise manner really rose to the task. So it's been a pleasure to see him grow in that way as well. And he really got everybody's respect, both of his peers and of the program in the process. His research interest and publications have been in gynae brachytherapy, cine MR for ENT, and smoking cessation. He received the Robert Brady Award in 2020 and the Croft Resident Elective Travel Award. He participated in professional enrichment program. And on a personal note, some of you may know, but he has a twin brother who is also a doctor. So I'm sure that his parents and grandparents who I hear are in attendance at their graduation are very proud of them, and the whole and other siblings as well. And Yoni will be going to UCLA for a brachytherapy fellowship.
So thank you. There is a lot that I value for my time here. First and foremost, all of the UTDRO staff are inviting us to enjoy both inside and outside of the clinic, join their work and their lives in various ways. There's so many role models and people I aspire to emulate in various ways. I wasn't going to list names, but I can't help myself. You know, you want to channel the determination and leadership of Andrea Baziak, the energy of Arjun Sehgal, the attention to detail of Laura Dawson, the wholesomeness of Eric Liang, the efficiency of Meredith Giuliani, the compassion of Jennifer Croak, the contouring mastery of Ali Hosni, the mentorship of Hans Chung, the versatility of our PAs and NPs, and the unwavering support of all of my co-residents from my year and all other years. So thank you all so much.
Thank you, Yanni, and congratulations again. I should apologize to Gordon. I forgot to mention one of your Carol awards for your poster. Sorry, Gordon. And last but not least, alphabetically, Liang Zheng is our fourth PGY5 resident who has successfully completed his program. He came to us from Waterloo and from medical school in Toronto. And Liang is an example of what I would call quiet excellence, always calm, always low key, but from the beginning, strong clinically, strong research wise, and it just continued to grow as the years went on. Several first author papers, mostly on spine SRS and lung hyperfractionation, recipient of the W.J. Simpson Award for Academic Excellence in Research in 2020, the Caro 2018 Prize for Best Clinical Care Resident Abstract, and many previous awards from his undergraduate studies. He's been involved in teaching, mentoring medical students, and has always maintained a balance from what I could tell with professional and personal life. And I think his wife, Karen, and I think a puppy are here as well to support him and congratulate him. He's staying in Toronto at Odette for a CNS fellowship. Congratulations, Liang.
Thanks, Dr. Baziak, for those very kind words. Yep, the eye bags are reflective of the new puppy coming in and not sleeping for longer than 3 hours in a row, but it's a fantastic experience. So we're asked to talk about our what we valued most during our time at UTDRO, and I think I just have to echo what everyone's really sort of focused on, and it really is the community and the people that make up the UTDRO community, from the radiation oncologists, physicists, radiation therapists, allied health, administrative staff. I think everyone from the beginning was so welcoming and approachable and allowing us to join the community. And it was clear that from the beginning that our education, the training, and the mentorship was at the forefront of all our interests. And I'm so thankful for these relationships, and I hope that they'll continue and guide me into my career. A special thanks, of course, to our co-residents, past and present, who provided all the support, the friendship, and of course, keeping each other sane over the past couple of years, especially this past year. So thanks, everyone.
Thank you. Congratulations once again to all of you. And it's a pleasure to pass on the microphone to Dr. Rachel Glicksman, one of the co-chief fellows who will be speaking on behalf of the fellows.
Thanks, Dr. Baziak, and congratulations to all of the graduating trainees tonight. I'm happy to be speaking on behalf of the fellows at both Odette and Princess Margaret. There have been 28 fellows over the course of this academic year, and despite all of the challenges that this year has brought with it, it's still been an exceptional year from an educational point of view, and we of course have many people to thank for that. First, to our individual supervisors, we thank you for your dedication to our learning and for your mentorship and support and friendship during an especially challenging year for everyone. We want to thank Dr. Croak, the program director, and Dr. Solomon, the associate director, for all of their leadership and support and guidance during this time. And last, but certainly not least, to the entire UTDRO team, Eileen, Megan, Catherine, to Razia at Odette, and Fia at Princess Margaret. This has been such a logistically challenging year with fellows coming from around the world into Toronto during a pandemic, and we really appreciate all of the work that you have done behind the scenes to keep everything running really smoothly. So thank you so much to everyone for such a fantastic year for the fellows. And with that, I'm going to hand things off to Dr. Jennifer Croak, the program director for UTDRO Fellowship.
Thanks so much, Rachel. So nice to see everyone. I wish it was in person, but hopefully next year or maybe later this summer. A lot of people have already said some of the things I would say, so I'll skim over it for sake of not being too repetitive, but I definitely want to shout out to UTDRO, Eileen, Catherine, Megan, Evan, pre-Megan. You know, I just joined on as program director back in the fall during the pandemic, which when it was a bit of a steep learning curve and delayed fellows and fellows extending and et cetera, but they were always there to to guide me along and very, very helpful. So thank you to them. Thank you to Pete, Dr. Peter Chung, who helped lead the program for several years before me and continues to be a great resource and help when I have a question. Dr. Hanny Solomon, as Andrea, Dr. Baziak said, thank you so much for all of your hard work and dedication over the years. And a welcome to Dr. Irene Karam, who will take over as the associate come July. On site, we have help from Odette, we have Razia, and on PMH, Fia and Marcia, who help a lot of the day in, day out logistical stuff. Dr. Rebecca Wong and Dr. Mei Sao, who help lead the educational portfolio as well. And but I would be remiss to not thank all the fellows. I know there's 14 graduating, but as Rachel said, there's 28 that have come through the program. The fellows have been just phenomenal during the pandemic, as all the trainees. All the trainees have been very dedicated to patient care, to work, to research, and without a lot of their families, because as we know, most of our fellows are not Canadian. So they have left their families to come to a country where they have to do everything virtually. So it's definitely been a difficult year and a challenging year at times, but hopefully still one that's quite valuable and memorable. And so without further ado, and the chief fellows, sorry, I have to thank Rachel and Michael and Enrique and Mariana for all their help in leading the fellows. And so I'll start from alphabetical order as well. Our first graduating fellow is Dr. Ahmed Abougarab, who completed a fellowship at the Odette in CNS and head and neck cancers. And he has taken on a staff position in Sohag University Hospital in Egypt.
Sorry, you can hear me right now?
Yeah.
Yeah, okay. Thank you. I would like to thank everyone for their time and their effort. And okay, after finishing, I know I have only 1 minute, so I will be quick. After finishing, I will go back to like my staff position, like in Egypt, in Sohag, my city. And what I appreciate very much here, of course, like besides the scientific part, the teamwork, it's excellent. I have been seeing like the teamwork, like I have been like in the CNS team first, and then a head neck team, then the head neck team. and the teamwork here is excellent. And I think this is one of the powerful points like in the Sunnybrook and in Toronto University. Thank you.
Thank you. Next, Dr. Ahmed Boucheri, who completed a fellowship in GI and head and neck cancers. And he is currently a staff radiation oncology at Kuwait Cancer Control Center.
Thank you, Dr. Kroc. So I spent more than 8 years at UTDRO. I can't value more than the relationship that I have built with my mentors, colleagues. So I can say UTDRO is my second family. I also value the quality of education that I got, as I feel very competent in my job. And this is something I'm very grateful for. So thank you very much to all of you.
Dr. Mark Corkum, who completed a fellowship at the Odette in the brachytherapy AFC program, focusing on GU cancers. And Mark is moving to Ottawa to take on a staff position there.
Thank you, Dr. Kroc. I just wanted to echo what everyone says. My experience at UTDRO has been absolutely fantastic. It really is a fantastic community that exemplifies all aspects of professional and personal balance and well-being. I'm incredibly grateful for the mentors and friends that I have met over the last year, and people that I'm hoping and planning on keeping in contact throughout the rest of my life. Thank you so much for this fantastic year.
Thank you. Dr. Archia Dasgupta, who did a fellowship in breast cancers at the Odette, and he has moved back to take on a staff position at Tata Memorial in Mumbai, India. I'm not sure if I see him on the Zoom call. No, okay. No, okay. But congratulations to Archia. Dr. Ahmed Elamer, who did a fellowship in GI cancers and lung cancers, and he is doing a postdoctoral fellowship now in radiation oncology at the University of Texas Southwestern.
Thank you, Dr. Kroc. I'm very happy to meet you virtually. In PNH will really and always be a feather in my cap. And I really appreciate the genuine support and friendly environment I had, and all my mentors were really supportive, but I have to say Drs. Hope and Hosni was really amazing. So thank you all for this very lovely meeting. I'm very happy to be around you again. Thank you. Thank you, Dr. Bijak. Thank you and I cannot forget Dr. Bijak. She supported me a lot. Thank you, Dr. Bijak, one more time.
Thank you. Dr. Rachel Glicksman, who completed a fellowship at the Odette in GU cancers, who will be coming just down the road to Princess Margaret starting in July to join me in the breast group and GU.
Thanks, Dr. Kroc. It's been a fantastic year, and I really want to thank my fellowship supervisors, Drew Lovell and Will Chu, for their mentorship and support. And it was such a privilege and so much fun to get to work and learn alongside of them all year. I also want to thank the whole GU group at Odette for being so welcoming and supportive, and for the opportunities that they've given me. And I'm very excited to stay in the UTDRO family and join the group at Princess Margaret very shortly. So thank you.
Dr. Mektakshi Gupta, who completed a fellowship here at Princess Margaret in gynecological cancers. And she is currently a neuro-oncology research fellow at the University College in London. She also could not be in attendance. Next, Dr. J.C. Kenneth Jacinto, who did his fellowship in head and neck cancers at the Princess Margaret. And he will be moving on in July to do a fellowship at MD Anderson in Texas.
Hello, good evening, everyone.
first of all, I just want to take this opportunity to thank everyone from UTDRO for the experience over the past year. It was very challenging, especially during this difficult time. But I really enjoyed my stay here in Princess Margaret Hospital. I truly value the effort and the time spent with the staff, the day and the times that we discuss and dissect every case. I truly appreciate it. And I really felt the enthusiasm of all the staff, and they really want to share their expertise. So now I'm gonna move for another fellowship, and then I'm gonna come back to the Philippines, really hoping to bring progress back to my country, especially radon for practice of radon back home and to improve patient care. So again, thanks to everyone, and I really, I'm happy to meet all of you, hopefully in person in the future. Thanks.
Thank you. Next, Dr. Revthi Krishnamurthy, who completed a fellowship at Princess Margaret in breast cancers and lung cancer. She is now an assistant professor in the Department of Radiation Oncology, also at Tata Memorial in Mumbai, India. Don't think Revthi's on the line as well, either, sorry. Dr. Richard Moore, who completed a fellowship in lung cancer at Princess Margaret, and he is currently a staff at the Mater Private Network in Ireland.
Thank you, Dr. Krog, and thank you all. Thank you to my supervisors, Drs. Baziak, Dr. Sun, Dr. Waldron, and all of you in the UTDRO program. You've been wonderful, wonderfully supportive. So I've returned to Ireland in early 2021 to start my new position as a consultant radiation oncologist in the Mater Private in Dublin, here in Ireland. And my family and I had a truly memorable 18 months to take back with us from Canada. Greatly value the experience and the friendships I gained. And I think I'll reference Yoni Weiss, who put it so well. There's a great skill set in the department. So thank you all very much, and I look forward to catching up with you in person, hopefully when COVID settles. Thanks, Dr. Crook.
Thank you. Dr. Avinash Pilar, who did a fellowship in GU cancers, lymphoma, and head and neck cancer. He has moved on, and he's a clinical fellow in proton therapy at the Christie Hospital in Manchester. I don't believe I saw Avi on it. Okay. Next, Dr. Hendrik Tan, who did a fellowship at the Odette in CNS malignancies and lung cancer. He's moved back home. He's a radiation oncologist now at the Fiona Stanley Hospital, Perth Western in Australia.
Thank you, Jen, and it's great to see everybody here virtually. So as Jen mentioned, I'm starting work here at the radiation oncologist in Perth, West Australia. In fact, I'm actually starting work next week. So I had a little bit of a break since I came back from Canada, which is really, really nice. And during my time at UTDRO, I truly value the camaraderie and the support and teaching that I received from my supervisor, Dr. Henry Solomon, Dr. Stan Mahak, Dr. Alex Louis, and also from all crafts group, and the friendship I made with the residents, co-fellows, staff, and mentor, whom I crossed paths with. I have to say the experience as a whole, from both personal and work standpoint, has been truly invaluable. And I would definitely encourage our trainees to actually take on the fellowship at UTDRO in the future. Thank you so much.
Thank you. Next, Dr. Conrad Villaferte, a prop fellow at the Princess Margaret, and he will be taking on a staff position at the medical city in the Philippines, Antonio School of Medicine and Public Health.
Hello, everyone.
Hi.
Hello. I really valued and am very thankful for all the people that I have met and got to know during my time there in PMH. All of them made my stay in the Department of Rad-Onc productive and enjoyable. Of special mention are the excellent staff and personnel in the PROP program, from whom I have learned a lot about giving short course radiation treatments. This is not common here in the Philippines. So thank you, Dr. Dawson, Dr. Parry, Dr. Cummings, Dr. Miller, Dr. Ward, Dr. Wong, Dr. Ringash, Joanna, Felicia, Grisel, and Christine. I was also lucky to have co-fellows and residents with whom I have become good friends with. So I finished fellowship and left Toronto last January. And since then, I have started seeing patients in Manila. And I believe that I have already started to apply what I have learned from PMH to my patients. So thank you again, everyone, for accepting and teaching me there in PMH. I hope that we could see each other again in person in the future.
Excellent. And last but not least, Dr. Michael Wang, who has completed a fellowship in CNS malignancies at the Odette Cancer Center. And I'm in for, he's not here. He's not on the line either. But congratulations, and congratulations to everyone. And congratulations to all of the fellows who will be graduating next year because of staggered starts and delayed arrivals to Canada. And we look forward to hopefully getting some social events sooner rather than later. And now I will pass over the virtual platform or the virtual floor to Cody Copeman-Hubert.
Evening, everyone. Thank you. Yes, I'm Cody Copeman-Hubert, Associate Director of Alumni Relations and Special Events at the Temerty Faculty of Medicine. It's my pleasure to congratulate you all on completing your postgraduate training in the Department of Radiation Oncology at U of T, and to officially welcome you to our Temerty Medicine alumni community. Completing postgrad medical training is always a huge achievement, but, and as many others have already mentioned this evening, this year in particular came with some unique challenges, unlike those faced by any other grads before you. I'm sure you've had to juggle more than you'd imagined and have had to dig deep at times to find the strength to continue, but you've made it. And you should be so proud. I know we all are. And while you're finishing your training, this certainly isn't goodbye. Some of you are already alumni of our faculty, but many others are joining our community for the first time and joining an esteemed 61,000 healthcare professionals and leaders around the globe. As you embark on this next chapter of your lives and your careers, I hope you'll keep in touch. We want to hear from you and find out what you're up to. There are so many ways to stay connected. Whether it's through attending lectures and reunions, mentoring current students and trainees, volunteering on awards committees, or simply receiving our alumni newsletter or award-winning U of T Med magazine, there's something for everyone. My office will be sending you a brief follow-up email in the next few days. So if you just hit reply, you can let us know the best way to keep in touch. And in the meantime, please enjoy the remainder of this celebration and this very special milestone. And now I'll turn it over to Dr. May Sao, Vice Chair, Education, to give her closing remarks. Congrats again, and thanks for your time.
Thank you. It's so good to see everyone virtually. To all the residents and fellows, congratulations on all your hard work and success. So everyone stay where you are because we're going to have a social and networking portion of this evening, which will commence shortly. There will be program-specific breakout rooms that have been created for you to celebrate with your family, friends, faculty, and peers. You can also ask the administrative staff, such as Megan Ward, to create a different breakout room so that you can have conversations with a select group of people. And this is the exciting part because right now we're going to join each other in congratulating the UTDRO class of 2021. So at this point of the meeting, feel free to unmute yourself, use your emojis so that we can all hear you clapping and cheering for the graduates of this academic year.
Congrats.
Good job, everyone.